And we're live. Good morning, good afternoon, good evening, everyone. Welcome to another episode of Hierarchy Betrayal podcast. Today is the 24th episode. Myself and Kimberly, my amazing host, we are glad to be with Andrew Williams, which we're going to introduce quickly. And actually, you introduce yourself, Andrew, but for just a little bit of check on the scene. So today we're streaming from StreamYard and we are on LinkedIn and YouTube. So I think we are live already. And just a little check because before we're going live, I think there is a little bit of lag. But anyway, let's see. Yeah.
We are live.
With me.
Happening now. We are
Yes,
live.
maybe my StreamYard. Bear with me. I don't know what is happening. Just a second. Okay, sorry.
Is either great
yes, we are live. Good morning, good afternoon, good evening, everyone. Welcome to another episode of Hierarchy Betrayal podcast. Let me repeat myself because probably no one heard me before. So we're streaming from StreamYard on LinkedIn and YouTube. I am Dina Paoloni. I am one of your co-hosts, and I am an international educated nurse from Italy to UK. And I'm a career coach for international nurses. My co-host, Kimberly Maurer. Kimberly, how are you?
I'm good, honey. I'm good. It's a beautiful day in Michigan. I made the trip home yesterday, so my son gets married this coming Saturday. So I am here in the Michigan. So the weather's beautiful.
Congratulations.
So it's good to be home. It really is. I haven't been home since January, so it's good to be home. It's good to be here. And good morning, good afternoon, and good evening to everybody that shows up today. And we appreciate you so much. We have an incredible guest today, Andrew Williams. He is a ICU burn nurse, and he is a leader in his unit and his department. And he and I have been connected for quite some time and have had many conversations. And I feel that he will be a delightful addition to the conversations and to the Hierarchy Betrayal. So, Andrew, do you want to take a moment, honey, and introduce yourself to the peoples?
Good morning. My name is Andrew Williams. I'm the director of the burn ICU at a hospital in Lafayette, Louisiana, and I'm also a ER nurse in another organization here locally. I do have to do the corporate disclaimer thing. My thoughts are my own, and they do not represent the positions of my respective employers.
Thank you very much. Amazing. So yes, we are finally live. Actually, at least on my end, there was some lag, and so I couldn't see ourselves live. But we are live, and we got some amazing people showing up already. Good morning, Kenneth. Thank you for coming.
Everybody that's coming in today, awesome. And Darlene from Cortinas, she posted a really good post today, an article about the handoff and nurse leadership and whatnot. So, of course, reading her article, I was inspired for our conversation today because we want to talk about all of those things. And, I recently had written a post about friction without exile. Where you can have those conversations with leadership without being dismissed from the table or worry about being put into corrective action or, afraid to raise your hand. So it was that thought process that I think so many of us have experienced one way or another, whether we're the one that's raised our hand or we've seen someone who has and what's happened to them after the fact, has truly spike these kinds of conversations that we all need to keep having, because you should be able to speak up. You should be able to have conversations safely in these environments, because we are taking care of people. We are there for a reason, but we have to take care of each other too, and stop competing and start collaborating more and support one another, because we are the change, you guys, that we want to see. And until we start working together and seeing past all of the drama and all of the bullshit that happens every day in the workplace, and that's where change is going to happen. That's where we're going to truly see things change for the better. And I think all of us can agree that we really want to see healthcare beautiful, and it is a beautiful and brutal profession all at the same time. But how we choose to show up and support one another every single day is what's gonna change what we're seeing now, and what's going to change the brokenness that we see. So
absolutely. And we know that nursing now in this very fast evolving healthcare system is facing a revolution. And so what we want to do with the Hierarchy podcast is actually to name all the difficulty, the odds, the problem we are living every day in nursing, without pointing the finger to anyone. Just try to have conversation that can inspire, raise awareness, and make us more collaborative. And so taking the point of view of every stakeholders to co-design a better nursing. So taking the opportunity of this evolution and revolution in this fast changing healthcare system to make sure that the younger generation nurses will be able to have a productive nursing, and nursing that make them happy, fulfilled, and they can really satisfy patient needs. So happy to have Andrew with us. And Andrew, for those who don't know who you are or why you're here today, what do you think we should talk about today in this episode of the Hierarchy Betrayal podcast? Thank you.
So what I hope to take away from this conversation is a thought, and that's imagine if every nurse came to work knowing that they mattered. So I am undertaking an advanced degree course of study, a doctoral program in industrial organizational psychology, which is kind of a unique path for nursing leadership. Most people do a DNP and like executive leadership. I chose this specifically because it is the study of how team members interact with one another, how the leader interacts with the team members, how the organization interacts with everybody, and then that inverse relationship. So how can we make the nursing unit conducive for growth and for enhanced psychological safety, able to make the conditions as a leader for people to flourish? So that's sort of the takeaway from this conversation.
I love that. And I know Dina and I can agree that so many of the conversations that we've had with guests in the past, so many people don't feel like they matter. They don't feel like they come to work and they're valued. They feel like they're more of just a number on a roster, and that there's not any real deep dive into, hey, are you okay today? Or is there anything, you want to talk about? It's really being present. And I know from experience that a lot of times you don't see leadership. And if you do see them, they're walking around with a clipboard and taking notes of stuff, but it's like we've never had these conversations where, hey, how's it going today? Is there anything that you guys need from me? What can I do to make your guys' day better? Or, just those kinds of conversations that seem to not happen anymore. It seems like it's, everybody fend for themselves, and you get through the day and you go home and you come back and do it all over again. But did you really have a good day? And I would love to get back to the days where we just have a really good day, where everybody supported one another and the care was good. The team worked together, supporting one another, loving one another, give everybody a hug. I always want to give everybody a hug because I'm a hugger. But, it's just that safety of feeling that we have each other's backs. I'm not here to stab you in the back. I'm not here to see you fail. And a lot of times in leadership, are we showing that supportive like you said, conduciveness to where the team feels supported, they feel valued, they feel like they do have worth when they're there, and the changes that need to be made to facilitate that for sure. Andrew, I want to ask you, what is it that you do as a leader in your department that makes people feel that they're valued, that they matter? What is it that you do, and what do you see, and how can we encourage others to do kind of those same things?
Well, the first thing that I chose to do, and it's a choice, is I never talk about my department, my team in the possessive, because I'm just a member of the team too. When I go to meetings with other leaders in the building, they kind of razz me a little bit because I don't, speak that way the way they do. I look at my position as that I'm in a position to take care of people. So I always reply to that thought as, I'm here to take care of the team, to remove obstacles that are in their way. An important thing that we do every month, I have 38 people that are direct reports, I guess in technical speak, but I have 38 teammates up here, and we meet one-on-one for a half hour on their shift every month. So we sit down. I'll come in the middle of the night. I'll come in when I don't think it's fair to say, hey, I want to have a conversation, see how you're doing and talk, but to have them come in the middle of the day when they work night shifts, that's not cool. So I come in at 2 a.m. when I know that it's not, a task heavy time, and everybody comes in and we sit down and we talk. So when we talk about the things that are important to them, how do you feel it's going? What's in your way from doing your job effectively? What can I do to contribute to your feelings of growth? What opportunities do you need made available to you? How can I help you? I try to learn their kids' names. I try to learn their dogs' names. I try to throw that in there. I try to really make a connection. And I hate saying I a lot. I'm sorry. But it's I'm not terribly comfortable talking about myself. I enjoy talking about the people that I have the privilege to work with. So
that's wonderful. That's wonderful. And I can't say as I've ever heard of a manager or a leader coming in on the night shift to check on the night shift. I remember working night shift, and we always felt like the redheaded stepchildren. The parties were during the day, the events were during the day, those kinds of things, and you never really felt included. And I do remember so many of the nurses saying, we never see leadership. We don't feel included. So that's amazing. I mean, and it's so simple to do. You're just taking that time, and you're coming in and you're being present, and you're letting people see you. Because how many times have we worked in an organization or we don't even know who leadership is, or there's so many that you can't even put a face with a name because you've never seen them. So I think that is huge, and more places should do that.
So
just
people,
to create that safety.
And I think increase trust. So build trust, actually, because you engage with people and you ask personal things outside the work. And there are people that don't want to talk about, but at least if you ask, you show that you are interested in there. So this is very important to gain trust. Absolutely. I agree, and I do as well. Thank you, Andrew.
There was some pushback to this at first. Some people didn't want to participate, but now they look forward to it. I look forward to it. We sit down and connect and have this conversation. So,
Andrew, do you feel that I don't know how long you've been doing this, but as far as, you know, that time of coming in on night shift or that time of sitting down with everybody, but do you feel that the tension has eased since you started doing that? Like, people were probably afraid to speak up at first. People were probably a little hesitant to share everything because, you know, leadership, we think, I'm going to get chastised for this, or I can't speak honestly. I can't really say what's really happening because then I'm labeled or I'm titled as a troublemaker or a disruptor or, you know, causing problems. But do you feel that from the time that you started doing this to the present time now, that people come to you without even, you know, asking for that minute or that time that you are offering them freely, where they're just coming to you and talking to you, or they reach out to you because you've made them feel safe, you've made them feel welcome enough to where they can have those conversations with you without any friction that causes exile?
So they're kind of like both your situations. I live in an area where I'm not from. I'm not native to. So I'm a Nebraska farm boy. I live in the Cajun country of Southwest Louisiana. It's its own unique culture. It's like living in a crazy French immersion experiment at times because they have their own language. Cajun French is a distinct, French dialect. So there's a lot of phrases and things that I've had to learn to understand. Like as a fellow Midwesterner, we say, "Hey, come here." In Southwest Louisiana, they say, "Come see." It took me a little bit to catch on to that. So my phrasing, the way I am's been a little bit different. So we had to cross that barrier too. But now we're comfortable with each other, and the communication's increased. We've built a great rapport between myself and the team. And I see a difference in the team members too, because we don't call things mistakes around here. They're opportunities to learn, so we don't have that. I'm not the leader that's going to yell at you. I'm not the leader that's going to go straight to the write-up. Sometimes we have to do progressive discipline, but we've had a lot of opportunities to talk about things and express policy and procedure, and hey, let's try this differently next time, and things like that before we go straight to the formal disciplinary process. I think I've written up 2 people, and it was just, I had to do it. But even attendance, the attendance has improved since we started having these conversations. We don't have the call-ins. We have people that we're a very small unit. It's only 6 beds. It's very specialized. We're the one of 4 burn centers in the state of Louisiana, one of 2 that are verified by the American Burn Association. And on the 6-bed unit, we run 4 RNs 24/7, 365. So there's a lot of help. Since we changed our staffing model, that's also improved, team engagement. It's really a pretty good environment.
I would like to show some comment, because, for example, Kenneth, I think it's very fit what we were talking about, that you, Andrea, were talking about.
So Kenneth says, just showing up and being consistent plays huge parts to improvements in everything. I love that applying those logics to make it better for the billions of people, the millions of nurses help. Absolutely.
Absolutely. If we make nurses seen, nurtured, and then they are the nurses are the nurturers. So if we nurture the nurturer, and I think we have for sure better care. Let's say hello. I don't know. So, guys, if you don't give permission to StreamYard to show your name and surname, we don't know who you are. This is LinkedIn user, so probably on LinkedIn we know who is this person is, but from Spain. And thank you very much for showing up.
So hello everyone, just just from Spain. Internet connection works again after the fire disease. Nice to be able to participate today. Perfect.
So I can read it if you want, Kimberly.
Oh yeah.
And Jen say to this person, no, Cherry says to Jen's also. So the LinkedIn user was Jen's Brooke.
Oh, Jen.
You say.
Okay. Yeah. So it's different on StreamYard. So like if I was to go to my phone, we'd be able to see who the names of the LinkedIn users are. But for whatever reason, it's a StreamYard permission thing. So
yeah, exactly. Because we're streaming from different platforms. So hello, Mirella. Thank you for coming. Benvenuta.
Look at all the people from Italy today. This is unusual. Nice. Yes. So, and then Tara, let's see, Tara says. So Tara says, I lived this firsthand. After nearly 29 years with a major healthcare organization, I was abruptly terminated after speaking up, supporting my nursing team, and raising concerns about a charge I believe that implications for safety, humanity, and morale. I had been in my leadership role for 7 years. What was left in the wake of my termination was silence. People became afraid to speak up. Psychological safety cannot simply be something we talk about. Leadership has to walk the walk.
So true. Sorry, Andrew, some comment actually cover your image.
We cover you up, Andrew. Peekaboo! There he is.
Thank you, Amina from Egypt. Thank you for coming.
Oh, goodness.
So let's read this one. We already have a lot of engagement. Thank you guys for participating so much. We really love everything we do.
Hi, Vikash. I love him. Oh my goodness. Love him. So he's the one that's responsible for the chocolates. So anytime we have a campfire, everybody has their role. Or when Jack is responsible for the graham crackers, which, sometimes we get them, sometimes we don't. Vikash is responsible for chocolate. Dottie Hughes has got to bring the marshmallows. So, and everybody pulls up a chair and we have these conversations. So I'm so excited to see him here. He said, in my work as a corporate culture consultant, I recently sat down with a team of clinical nurses. When we discussed what makes staff feel truly valued, one key factor ignited a passionate debate: clinical autonomy. Nurses aren't looking for superficial praise. They want to be recognized as expert clinical partners alongside physicians. By encouraging interprofessional rounding, where their frontline observations are respected, healthcare leaders can transform workplace culture. Perhaps this, let's see if
could help out.
Yeah, it cuts out. Okay. That's so true. And it's guys, it's things like this, these observations and these things that we're talking about that hopefully will encourage other people to do things differently, or to at least be open-minded to trying something else. Because if you have a unit where people aren't talking and you don't have that collaboration, there's a problem. And you need to figure out what that problem is. But you're only going to do that, like Andrew said, by talking to people, by getting to know their perspective, by getting to know how they flourish and what's making them feel like they can't. So I'm so excited about this conversation today, because there's so much that people from all over the world, especially with this being global, that people bring in their perspectives from other countries. And, it seems that it's the same problem across the board. It really, really is. That silence, that feeling unheard, that feeling of not being valued, that feeling of what you have to say doesn't matter because this is the way we've always done it. I mean, how many times have we heard that conversation? Well, this is the way we've always done it here. Why would we change? So people stop speaking up because they're like, why bother? Nothing's going to change anyway. This is just how it is. But it's these conversations like this and people coming in with backgrounds like this and their observations and things that are working someplace else those are great ideas for other people to look at their organizations differently and be like, you know what, that was a great idea. I hadn't looked at it that way. Maybe I should look at it differently, or at least be open-minded to be able to look at it differently, and to be, again, to where you don't have such an ego, you shut everybody off. You know, you feel that you're way up here and they're down here, and they don't have that right to share that observation with you or that perspective with you. So again, Andrew, I think what you're bringing today is really sparking really good conversation. Do you want to touch on what Vikash just said, Andrew?
Well, I think it's absolutely spot on. I think that, for example, on Wednesdays at noon, we have a multidisciplinary round for the burn ICU that doesn't only just have a few nurses and the physicians, but we have the nutritionist, case manager. We have embedded physical and occupational therapy on the unit, pharmacy, and all of these voices come together to work on the care planning for the thermally injured patients. So that's an important thing. It's high engagement in that conversation. It does reflect that exact sentiment that our friend put up on the screen. Everyone has an equal voice. Everyone is able to share their thoughts on what's working, what's not working, and all of that is taken into consideration when doing the care planning for the patient.
And I want to absolutely, and I want to also say that this conversation is important because, as you say, Kimberly, this is global, and people are stuck in their mind thinking that, oh, we've done this forever, so we're still going like this. We do this like we always done. But these conversations are important because they show that actually it's possible, that there are other people that have done differently, and this doing differently actually works. And so I thank you, Andrew, to show up and give some of your amazing leadership example. And I want to show Cherry comment as well. She said, I think emotional safety is a major issue in nursing today. Congratulations, Andrew, for addressing this issue. And also I would say that we tend to say is management problem, is a leadership problem. The fault is the manager. The fault is belong to the leader. The problem we see, and we talked about this previously as well, is that also leaders and manager are really pressed down because actually they probably are in higher stress, a different stress, but also they live a high stress in their role because they have pressure from above and pressure from below. So they also have the rushes difficulties, and sometimes it's difficult to move and make a decision or adjust because you are in a position where you want to make everybody happy, but sometimes what is from above contrasts with what is below, and it's hard to maintain a certain position. So but when we show that this is possible with little tool and leader action, one by one after the other, is actually amazed how much we can see improvement. In emotional intelligence, Andrew, yes, what you were talking about. Can you share another example, emotional intelligence, of what you do in this?
Those emotional intelligence principles kind of get labeled as soft skills. They're really not. They have to be active skills. They have to be incorporated. I try to listen more than I speak when we have these meetings. I may ask a few questions, but I just let people talk. It's their perspective. It's what the team has to say. That's where the meat of things are, and they don't hold back. I don't want them to. They know this. I think when we were talking about the pressure that leaders are under today, one of my My opinion is that it's my job to shield the team from hearing those things. Like what I hear from senior leadership and above, I don't often share the negativity with the or what's perceived as negativity with the team. Um, we tend to focus on the positive things, and one of the things that we've done is we've changed the way we do care on the unit. So there's a thing called transactional driven logic or transaction driven logic, which is checklists, that clipboard you were talking about. Buzzwords like purposeful rounding or something like that. We don't check boxes. I got rid of all that stuff, much to the dismay of some other people. But we don't use that. We changed the logic up here to service-driven logic. Not only do we try to be relational with each other, but also, I hate the term patient. A patient is an accounting term. That's an economic quantity. That's what revenue's generated from. But the person in the bed, that's who we're taking care of. So that's what we refer to the patients as, the people in the bed. So we focus on, I go in and I don't do rounds. I go visit with the people in the bed, visit with their families. And I see every one of them who's there every single day. They know me. They know the team. We just on Friday we had a person that was injured over Halloween this last year in 25, and she had I think it was 47% third-degree burns from a Halloween costume that caught on fire from a candle. And she recently made a donation of a gong that we've hung on the wall out here outside of my office, and we dedicated that, and now we've had our first person who was discharged on Friday ring the gong and celebrate going home after their recovery. A lot of the team members that cared for them during their stay, during the dedication came, and it was a celebration. So there were 60 people, much to the chagrin of the fire marshal, who were in a small area that we dedicated this gong, and that's pretty cool. And that speaks to the relationships that we build with not only the thermally injured people, but with the team members too.
I was thinking about it too, Andrew, with the type of environment that you and your team are in. I mean, that's a lot to carry, and what you're seeing, and anybody that's dealt with a patient, or I'm sorry, a person in the bed with with burns like that, it's excruciatingly painful. The treatment is, and just and thinking of the cries, the screams, the pain that you're inflicting to care for those people, that's gotta weigh heavy. That's gotta be something that you guys carry so heavily. And having a supportive team like you do, it's got to help carry that burden a little bit. So where you guys are supporting each other, and you have that person that's doing that with you, but at the same time, that understanding of how difficult that role is. So I appreciate what you're doing to show up for the people in the bed and for your team in regards to carrying that trauma that they carry, that they have to carry every single day, and not knowing what you're going to come into the next day. So high five to you. Wow.
So cases of moral injury amongst the caregivers can be quite high in our environment. So we recognize that. So our model here in this facility, it is part of Catholic healthcare. So we really try to model a holistic style of nursing where we take care of the psychosocial, spiritual, and physical needs of the people. And we have we're the only unit in our entire health system that has a dedicated full-time psychiatric caregiver that's on the team, that's not only there for the burn victims but also for the team members. So there's a lot of, she watches out over all of us because of the stress of the environment that we're in. Fortunately, we don't do a lot of bedside debridement. We actually, again, our unit's unique, where we have a surgical suite on the unit, and a lot of the heavy debridement and dressing changes are done under anesthesia for the comfort of the victim. And you know, we can't guarantee a pain-free experience, of course, but we really try to mitigate where they have a great deal of discomfort.
Yes, and I saw that the work that you do is more to make a human flourish more than actually prevent burnout. Because if you make the human flourish, actually you make the burnout a very far away situation that could happen. And I've got also, if we can dive on this, Andrew, but I also have a comment from Kenneth to say, will paid cover counseling and therapy be installed in a nursing contract perhaps? Will the ability to have a judgment-free conversation with third-party people help with some of those stress in the field? You say you have your therapist, right?
Yeah, we have a licensed clinical social worker who is a licensed counselor. We also, as an organization, have a robust EAP program where if they need to go off-site to talk to someone, the organization will pay for 6 sessions. So, and then anything beyond that is covered by our insurance.
Okay. That's good. But yes, what I would like to dive in more is the fact that you work on flourish the human more than actually to work on burnout. Because when burnout happens, you're already lost, right? If you actually, because I'm a career coach for international nurses and also for leaders. And what I work with the most is emotional intelligence, cultural intelligence. And so before even prevent burnout, we should thinking about let the person flourish. What are the goals? What do they want to achieve in their career? Because do careers is not selfish. It's actually an act of kindness for the patient. Because when a person feels seen, important, that there's something amazing, they build up something, a new system or a new device or any innovation you can do with technology or in the system. This is not selfish. It's actually an act of kindness because the patient's going to benefit from, but also the team itself. So if you make a person feel important, valued, and make a meaningful contribution to the patient care, you actually make this person flourish. And when a person flourishes, the burnout become far away. So can we dive into it, please? What is your perspective about this? What do you do to do this as you're talking about this?
So I'm going to tell you a story I told Kim a long time ago. It's about my grandpa. So one day my grandpa and I grew up on a big grain farm in eastern Nebraska. And you know, I'm a little kid, I'm probably 6 years old. We're talking about how we make the plants grow. And my grandfather corrected me. And he's like, you know, we don't make the plants grow. How do you say it? He said, it's our job to prepare the soil, to create the conditions so that God can make the corn plants and the soybean plants grow and flourish and have a he didn't use the word flourish, of course, but that was his point. And what I didn't realize at that time, being a little kid, was he was talking to me about leadership. I can't make anybody flourish. What I can do is try to create the conditions to where they can have some healthy roots, and then they can flourish. Um, any guess how long we as humans have been talking about human flourishing? A long time. Aristotle talked about it. The Odyssey, that's a movie that is out right now, a remake of it, but that was actually a story about flourishing when Homer wrote that. He was talking about flourishing. There's a Harvard professor who's an epidemiologist, Tyler Vanderweel. He recently, well, actually, it's an ongoing study. It's called the Human Flourishing Project, and they talk about all of the conditions that are necessary for a human to feel like they're flourishing. So, psychological safety is one of them. If they're treated with emotional intelligence principles is another. Their religious life is another. Maslow, that's all about human flourishing. So as humans, we've been fascinated by this topic for a long time. So my line of study and my doctoral research is what leaders can intentionally do to create these conditions for the team members to flourish. So I'm sorry to my team because they're research subjects too, secretly, but we work to try to create those conditions here.
Oh, absolutely. Agreed. And this is why actually, I'm working on the nursing theory, which is the awakened nurse theories. And basically is the point is the nursing really, so we are on a cliff at the moment, right? We are on a cliff. Nursing is under an unprecedented pressure and emotional damage, and nurses are leaving the profession because they cannot take any longer. So we are on a cliff in a moment where the healthcare system is shifting so fast that the soil seems we're losing the soil below our feet. Mm-hmm. So I believe that we are in a moment where we fall down and the profession will be completely destroyed, devastated, or we start to fly. And so the nursing will take other level, unprecedented level. So I'm working on this theory with basically career coaching will help a lot nursing, because especially now where everything is changing so fast, and nursing role are changing as well. Some we're going to disappear, some nursing role we see appear some more news, and so I think the principle remains that if you think about that you can grow as a nurse, it doesn't matter if you want nurse to do nursing only for a job, or if you actually want to do, you're active on, to make your career, you still need to flourish in your nursing. You still be able to create something meaningful and new in nursing, because this is not just inspiring for you or for others and nurses, but this actually is the evolution of patient care. So I love these things. I love the fact that emotional intelligence is very important. There is Cherry. I don't know if Kimberly, you want to add something else, but I wanted to share some comment. Cherry said, blame won't solve the problem. I think all levels of nursing are impacted. I agree. From the bedside to the boardroom, nursing is shifting, and we have to realize it, because the more we are aware of it, the more we can actually make it worse, finally make it worse. And I've got so much, what is it? people that actually agree with Cherry. Kunal say, Cherry Mom, absolutely, we can never solve the problem or any problem at only a single level. Every level has its responsibility. So blaming is not really the...
Yeah, and that's what we talk about too, Dina, is it's not about pointing fingers or blaming.
Yeah, exactly.
It's like, okay, so we see what the problems are. How do we solve them? How do we come together as humanity, for surviving these types of environments and creating the conditions and planting the soil to where people can grow, people can continue to keep thriving instead of just surviving. We've talked about that so much. Are you just surviving your job, or are you thriving there? Do you want to go there? Do you light up every time you talk about your job, or is it something you just don't even talk about because you're just so frustrated? And it's that collaboration with everybody coming together and seeing the things that others are struggling with, or they know that something somewhere else is working, and they can bring those thoughts and those ideas without being automatically shut down because it was somebody else's idea. I know that some people in leadership, they have such an ego that if it wasn't their idea, then they're not discussing it, and we need to stop that, because your team and everybody around you is in the trenches. They're the ones that are living it every single day. They're the ones that are even making it work possible. So you have to take everybody's perspective into consideration. And again, like Andrew said, you have to be present enough to where you're seeing it firsthand. You're not just having people come to you and report to you about what's negative or what's happening. You have to actually be there, making those conversations and making those friendships even. I mean, I loved my work family. And, we knew so much about each other. And that, again, is something you need to do. Take the time to introduce yourself to your coworkers. Take the time to get to know people. And in a managerial and leadership role, too, you need to know the things that are going on possibly in someone's life that, suddenly they're calling out, but the backstory, that their husband is at home sick, or there's something, or they're going through a divorce and they're struggling with childcare. There's just things, there's always a root cause to why somebody is struggling, or why something is not working like it used to, or they're not performing like they used to. But you have to be curious. You have to have that curiosity and that real understanding of wanting to know, instead of just judging, instead of just making a judgment call and being negative about, oh, they called in again. Okay, but why? Have you had that conversation with them? Have you thought to see why they are? Is something going on? Is there something that you can do as a leader and changing, if it has to be a change in schedule, if it has to be they can only work on the weekends, or something has shifted so much in their personal life that it affects how they show up every day. And we've all seen that. We've all gone through something, divorce, a loss, a health crisis. There's always an underlying cause, but it's that leader that's curious enough to ask and to really care. That changes everything. It really, really does. That's my perspective on that. And I know I kind of ranted on, but I do that. I tend to do that. I get carried away.
Me too. And also the leaders help for to avoid competition, but raise a collaboration, because we said this several times before. Competition shutting everybody down, while actually the collaboration is actually a multiplier. When you collaborate on a new idea, things is multiply. The results is multiply, the price is multiply, the benefit for everyone. So Cherry say, I was a nurse in burn ICU, and yes, it's very hard emotionally. Thank you for your contribution. There is a question, Andrew, from the audience, but I'm not sure if I understood. Kunal say, I'm sorry I'm asking this. I hope it doesn't sound offensive, but how much do you think these donation actually benefits? I don't understand the question.
I think he was talking about when Andrew was talking about when that patient was finally leaving. and what she had written,
Okay, yes.
and they
Okay,
put
okay,
up
yeah.
on the wall. Yeah. So,
But yes.
Andrew, do you want to answer that, Andrew?
You want to answer? Thank you.
How did that affect the morale, or how did that affect the unit, and I guess how that patient felt when they left?
I think it was quite meaningful to the team, and it's since we actually just prior to the dedication of the gong had a patient strike it and ring out of the unit. I think it is meaningful. I think that donation, and this wasn't a great expensive thing. It's more symbolic than anything, but it carries a lot of weight. I think it really spoke to the team members. It spoke to the other folks that were taken care of. It definitely was meaningful to the family that made the donation. It was noticed by administration. It was noticed by it's noticed in the community. It's something that truly does matter. I think it's not about having somebody's name on a wall beside a gong. It's about what it means, what the gong's purpose is. It's to celebrate recovery. It's to celebrate flourishing.
So it's very similar to the bell you ring after cancer treatment.
Yeah. So they wanted
it's that
to donate,
acknowledgement. Yeah.
They wanted to donate a bell, but my neighboring unit up here is oncology, and they were like, "Hey, the bell is ours." I'm like, "Okay." So
okay, easy.
So we got a gong. Percussion's percussion, So, hey, you made a point earlier that I wanted to that it struck me. I think we need to reframe the question. Leadership's been asking a long time, how do we reduce burnout? The real question is how do we help nurses flourish? That's the question. So accountants run the world. They think about things in cost benefit analysis, return on investment. So they're worried about turnover and burnout, but we need to flip it. What do we need to do to make things better from the point of creating those conditions where people can grow? So it puts a different perspective on it and sort of changes the emphasis.
Yeah, absolutely.
Yeah, and touching on that too, Andrew, I think it's asking better questions, right?
Mm-hmm.
It's asking your team better questions, and not accusatory questions, curiosity questions. When you have someone coming to you and they're just really frustrated with something, it's just not working, and they're not the only one that's noticing it, but nobody else is speaking up. So I want to bring it to you. And then it's how does that person act upon it? Did they just talk about it? Oh, we'll look into it. How many times we heard that? We'll look into it. And then you never hear anything about it again, and it continues on as it was, and nothing changes. So I think it's also being open to those conversations and to that feedback that you're getting from people. Why else would you want to lead a team if you're not really leading a team? You're just holding a title and a position. If you're not truly getting out on the unit and having those conversations and asking those tough questions, those uncomfortable questions, how can you say you're a leader? How can you lead a team efficiently and safely? Because people are in such environments, not even just one specialty. It's across all nursing specialties, that there's something that can be done better in every specialty. There's questions that can be asked that are not being asked because everybody's afraid to raise their hand. Everybody's afraid of being titled and judged and called out and reprimanded for calling something out that's not working. This just isn't working, and it's not bringing to leadership like that as a complaint, it's a concern. So how do you get it taken care of when it's a concern before it becomes a complaint? I've had this conversation with a lot of people in hospitality and talking about service, and it's all about the experience. Whether you're, a guest, whether you're a patient, person in the bed, or you're the employee, it's how do we have these conversations to where things actually do change? It's not just talking, everybody nodding their head and everything stays the same. Nobody's flourishing in an environment like that. You
Culture isn't built in a meeting. Culture isn't built on a corporate retreat. Culture is not built in activities like that.
Agree.
Culture is built in daily, intentional interactions with people.
Agree. Yeah.
That's where culture takes its foundation and grows. It's team member well-being and the outcomes for the people on the bed. There's no separation there. If your team feels connected to each other with leadership, the outcomes will come. We don't chase numbers on this unit. I don't care about patient satisfaction scores. I care about giving our best and taking care of the needs. I've been told before that, people think this is a hotel. Well, hospitality and hospital share the same Latin root word. Hotels originally were places where people went to be taken care of. Think about the biblical story of the Good Samaritan. Where'd he take the guy? He took him to a hotel where the innkeeper took care of him. He paid him to take care of him. That's how we got our start. It's about giving permission to people to provide that experience to the person that we're taking care of and to each other. So your point is strong. That's the right thinking.
And it's the permission, right? It's the permission to just be. It's the permission to not have to overthink giving good care. It's not permission to feel like you have to ask for permission all the time to be kind. It's kindness is free, kindness is easy. And it's those experiences that are not only for the person in the bed, we carry those experiences with us forever. I mean, every interaction, I can remember all of the ones that really hit me, that have never left me. And, I was in labor and delivery for over 20 years, and I saw really good things in labor and delivery. And I also saw the loss in labor and delivery. And those things stay with you. They do. But when I had such a good unit, I worked with so many amazing nurses in there, and our manager was incredible, and our director was, and we supported each other. We cried with one another. We took that time to decompress and to have like a debrief of what happened and why did it happen that way, and how could we have done things better or done things differently. And then you think of, and I'm talking loss right now, how could we have made that experience for that family better? And then you're looking at simple things, keeping the doors closed, the lights down low, bringing in meals for them if they need, just that quiet time, but also that time of offering our presence. I'm here if you need anything. It's interjecting yourself into those experiences, because people carry those things forever. And we as nurses, we carry those things forever. And there's so many stories that I will never forget. I mean, I even wrote a whole article in Substack, and I think it's on my LinkedIn profile too, about a patient who came in and her baby was gone. And, you know, that seeing her week after week, you know, and hearing heart tones and doing her check and da, 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 da. And then for that one day for her to come in and then there'd be no explanation why. But it's every time that you have that experience with the patient, you're building trust, you're building security, you're making them feel safe, you know. And then when something really good happens or something bad happens, they feel that they can lean on you. You know, they feel that they can cry with you. They feel that you understand. And it's just, there's so many ways that we can do better, you guys. There's so many ways that we can show up better every single day, not only for the patients, but for each other, for ourselves. And I just wish that more people would realize that, because it's not just about leadership's crappy or everything here sucks and this is broken and that or other. But it's like, are you looking at yourself? What are you contributing that could make this worse or is making this worse? Or what can you contribute? What can you do to make things better? And then have those conversations, because we're surrounded by brilliant people, educated, knowledgeable people that are carrying lives and carrying a life full of experiences that have brought them to where they are. And Dina and I have talked about this before. You might know something I don't know. I might know something that you don't know. And when we talk about alphabet soup, all the titles behind your name, that's not clout, that's knowledge. That's an opportunity for you to bring that knowledge and to share it with the people around you, because it only makes you stronger. You grow together. You're learning new things. I mean, I love educating and talking about things that I know that somebody may have never even looked at it that way. And it's like, well, you're like having a eureka moment, you know? So again, I just feel that as a humanity, I can't even talk today. As humanity, we all possess the power to make things better. We really, really do. And it's just taking that deep look and sometimes stepping back and looking at the big picture, that there is so much that we as individuals can do to make everyone flourish. And I just know that if we keep having these conversations and we keep bringing people that have different perspectives, different ways of looking things, and who are successful in different countries, different states, and bring the way that they've found ways to make things better and things are working, that's shared knowledge. We're sharing knowledge every time we have these conversations. And I know that I do. Every time we have these conversations, I walk away with a whole new idea, or sometimes a whole new way of looking at things that I didn't think of before. So these are always great ways to bring things to life that people just either pretend isn't happening, put blinders on, or they open their mind and are like, wow, that was really good. I'm going to try that tomorrow morning. You know, I'm going to go into work and I'm going to try that. I'm going to go visit every single patient, or I'm going to go sit with every single team member and see what's happening and see what I can do better.
And you know, Kim, what actually I used to do with my patient or with my colleagues or with the client I work with, the nurses who want to improve their career. And I think this remark, what Andrew was saying early on about being present with patient, but also with team member. When things become tough, I usually say, we are doing this together. We are in this together. Could be the patient during Christmas Day that receives the gift from the hospital because there's no family around them, or the nurses doing the third shift because it's needed, so it's just tired that it's hard to go through the shift. We are in this together, because saying we are in this together is actually build trust and build emotional bond between people. And there is this amazing feeling that we are here for each other. No matter what's happened, we are here for each other. And I've got a beautiful comment from Vikash. Sorry, Andrew, we're going to cover your face. Apologize for that. Which say, in my work as a corporate culture consultant, I recently sat down with a team of clinical nurses. When we discussed what makes staff feel truly valued, one key factor ignites a passionate debate: clinical autonomy. Nurses aren't looking for superficial praise. They want to be recognized as a healthcare clinical partners alongside physicians. By encouraging interpersonal rounding where their frontline observation are respected, healthcare leaders can transform workplace culture. Perhaps we could, and I miss a piece. Yes, but I agree. I come from Italy, and where nurses are not valued at all. And I came in UK ICU nurse as well, cardiothoracic. And I came to UK. A doctor were asking me, was I were thinking about a patient because I was the person who were there for 12 hours. So this for me was mind blowing because I felt so valued, so important, and so needed. So what is your take from it, Angie, if you want to remark something?
So it is about engaging with all levels of the interdisciplinary team, taking our physician partners here listen to us. We're their eyes and ears. We are who they rely on because they're with the person that they're taking care of for 15 or 20 minutes during the course of the day, whereas we're with them the balance of the 24 hours. So we need to have that ability to be those eyes and ears, and then communicate upstream back to the provider, and not be afraid to ask questions, not be afraid to speak up when we notice things that we need to elevate that. But I feel like the providers then respect that when you ask those questions, and when you show them, to Kimberly's point, we are educated people. We have experience. We know what the pathophysiology is in a disease process too. We approach it a little differently than they do. Whereas they look at it from the science behind it, we look at it as, hey, this ain't working. We need to, what else can we do? It's part of that SBAR, providing that recommendation. They listen, they learn. It's a trust. Trust is something that needs to be established amongst not only me and the team, but between the team members and the providers. And most important level of trust is between caregiver and the person in the bed.
So I've got another comment from Ken. He said, I don't think it's fair how nurses in Alberta, for example, have been tasked to start doing the task of the doctors. The policymakers are trying to pass off the failures to acquire doctor by tasking nurses to do those roles. These should be addressed in a political way as well. I think this is because also this is one of the reasons why nursing is evolving as well, or at least it's expanding from other direction. I don't see it necessarily as a negative thing, but I think we should be more firm on what nursing roles are now in this shifting healthcare system. What do you think about, guys?
That's interesting that Alberta would be pushing that provincially. There is a clear delineation of roles, especially when it comes to diagnosis and prescribing and administering medication. We have to stay within our scope of practice, respectfully for our, just to make sure we don't get into regulatory trouble. So I'm really surprised that Alberta would be moving in that direction. I'm going to look into that and see what they're doing up there. That's an interesting concept.
Reb, I think it's right what you said. Yeah, I mean, we should remain firm on our role, because there are places where nurses and doctors may overlap each other or can mix a little bit, but make sure that we don't go away from our role, our scope of practice at different country by country. But yeah, we must be firm on what nursing is, which is care, not necessarily cure. I've got someone else. So Melinda said, Kenneth, I think she was answering back. Nurses are the catch-all. We believe in holistic care and cover all the gaps. Do a procedure, take out the trash, throw the lab, give the bath, do a treatment, comfort the family, go to a meeting, give the meds, and offer a cup of coffee, because we care. And that is true also because of proximity on what we have, because we are 24/7 and we are embedded in the world. So it's also because of proximity. But this is another point. We should remain in our role, in our scope of practice, even from doctors' practice and role and things to ancillary as well, administrative. So we should be more firm on what we should do or not do. But why are we putting that much more workload? No. We understand, and we understood your connects. Yeah. What do you point, Kimberly? What do you want to say about this?
Well, yeah, we totally understand, and definitely it's the scope of practice. It's staying within your lane, those kinds of things. But it's definitely something I want to look into as well. I'm curious, like Andrew said, of what they're doing and how it's getting outside those specific roles and those specific duties that only a doctor or a physician can do, as to what a nurse can only do, and doing it safely, and obviously you want to avoid litigation. You don't want to stir the pot, for sure. So yeah, I definitely want to look into that as well. It's a good point though, Kenneth. I appreciate your presence today and sharing that, and you're making us think. I like it.
Well, being a career coach for international educated nurses, I see scope of practice, nursing scope of practice all over the globe, especially in English-speaking country, the West and the Middle East. So I see the Canada, for example, the region trying to change and adjust based on their needs, and for healthcare in general. For nursing, for example, they open windows where the long process for registration from abroad become very short, because they need nurses. So instead of being 1 year and a half, 2 years long, they make it quickly because they need in a certain period of time. And so I see Canada change here and there. Sometime I just here, sometime I just there for a short period of time to make sure they have enough people to care to patient to the population. So this is why, but I'm not in specific what Alberta is doing at the moment. And for this reason, I always encourage to be sure about the scope of practice, learn about the scope of practice before moving another country, or if you are already abroad and you want to grow in your career, because every system adjusts based on their need, and they adjust registration process, they adjust the visa, they adjust things to make sure that they have enough healthcare profession to taking care for people. But yes, it's interesting. We are really 50 past an hour, Andrea. What do you think we didn't talk about that you think is important to talk about today about nursing leadership and how to do nursing leadership properly?
So, to be a leader, you have to be given permission to lead. So, just because you have a title doesn't make you a leader. The team has to accept you as a leader through earning it. I think a lot of nurse leaders think they're entitled to respect based upon a position someone hired them for. It's not the case. You have to be involved with people to develop the leader member experience. You have to. There's a leadership theory that's literally called leader member exchange theory, and it talks about the contract, the deal that is done when someone takes a position like this, to where you earn the respect of the members of the team. So that has to be cultivated, much like the conditions to flourish. You have to invest yourself into that. So it's not automatically granted the status of being the leader. So we need to take time to develop those things, and that's done through intentional actions.
And agree. And this is why, for example, to me, but with Kimberly as well, some leader comes, they are burned out because they come and say, I do my best, but no one listen, no one think that I'm doing the right, that I make the right decision. And so there are many leaders who are burned out and they do their best, but their team don't like them actually. And I think that one of the biggest problems is this one, that they have a job that's been hired for that position, and so they think that automatically people were going to listen to them, which is not the case, because leadership, you have to show leadership to become a leader. You have to act intentionally, as you say. And one thing that Kimberly always say, I love it so much, that when she worked with leaders, she say, well, let's start to the basic. What is your why? Right, Kimberly? I think you should explain on me.
That's a big message that we work on together, is why do we do this?
Right. And I always tell people, go back to your why. Why did you get into this profession in the first place? Why do you stay in this profession? And if something's not working, why? And you have to do that inner reflection as well. You have to take a look at yourself. And that's why I encourage people to journal. Write it down. Write down your day. Write down the things you observed, how you maybe were approached by someone. How did you react? Because, that's always a ripple too. And the reaction, and how was that conversation, how did that conversation go between each other? Did you guys leave the conversation angry? Or do you feel like you came to some sort of an agreement, or some sort of a resolution, or some sort of, oh, wow, I didn't think of it that way, and then you dig deeper, and then that's where curiosity comes in. And that's how the best cultures just keep growing, because you're working together and you're bringing things to light that someone didn't look at it that way. So I always say, just always go back to your why. If you've lost your way, go back to your why. That's going to fix, I won't say it fixes, but it definitely gives you a different perspective and a new way to maybe look at what you're struggling with at the time. And so many people, when they do journal and then we meet again, they're like, oh my God, I didn't realize how much I was carrying. I didn't realize how angry I was about something. But once I wrote it all down and then I read it, then I speaking out loud, I actually gave myself ideas to how I could have handled it better, or how I can fix it, how I can change it, or how I can show up differently. So I always just recommend people journaling, but just never forget your beginning. Always remember your beginning, especially when you're in environments when there's new staff, there's new grads. My God, give them grace. Give them grace. You didn't know everything on day one, and you still don't know everything. But again, if you have alphabet soup, or you even just have whatever letters you do have behind your name, teach them. Teach them, you guys. Show them the way. Because if you've had this career for 30 years and you've seen things that you wish were done differently, and now you have that experience, save the new people a few bumps and bruises, will you? I mean, seriously, save them some bumps and bruises and show them the way with kindness and with gratitude. And just, we have so much every single day. Every day we have the opportunity to, like we were talking, grow someone. And I don't know it's much like that wording, but you can grow someone. You can grow someone. You can change their trajectory of how they show up. And if they feel supported and they feel that they are allowed to make a mistake, and not even so much as a mistake, they've done something that they thought was right. They went on it based on the knowledge that they had, but someone else is calling them out on it and showing them a better way. Showing them, like you talked about, Andrew, earlier, it's a learning tool. It's learning. We're all learning every single day. And if somebody knows something, somebody doesn't, then share that knowledge. That's how we grow. That's how we grow together as a team. These are people that you spend 12 hours a day with. You have to want to work together, and you have to want to just be a supportive working environment where you want to go to work every day. You want to show up every day. You're not sitting in the back bathroom writing your resume. You're not looking on LinkedIn or Indeed trying to find a way out of this environment. How do we make the environment better? I think that's one of the questions that we have to ask. How do I do better? How do we do this better? Because we can always do better. Every single day we can do better.
And another thing, I think that leaders try to do better, and they think that they must look to certain articulated solution for their problem, while actually the simple things is usually that works better. And so, for example, go back to your why. Another thing is listen your team, because by listening, you understand their needs and their problem, and then you can act to give a solution. So as Andrew, you said, you must act intentionally with your team, and we don't really need to looking for any extra complicated solution to the problem, because we know, especially the science teaches this, the best solution sometimes is the simplest one, the most proximate solution. Andrew, I know that you've done a rough night, so I thank you so much. You spend all this time with us, but I think you may need to go and rest a little bit. I've got just another comment I want to share, and then I may ask you a last things, if it's okay for you, Andrew. Thank you very much. So, Kimberly, you want to read? I'll read it for Kenneth.
So Kenneth says, and I look forward to Kim joining me on Thursday. Oh my goodness.
Shameless
self-promo. Oh my goodness, too funny. Today's cast is a brilliant reason why I'm hyped. The kind of depth we can achieve can always be brilliant, even if we're just trying to scratch the surface. Absolutely. So he has a new podcast, and I'm going to be his second guest, and I'm doing this with him on Thursday night. So, and he is in Canada as well. So I'm excited about this conversation, and we're kind of going based off a lot of things, but we're talking about the being valued in healthcare and things that really a lot of what we talked about today, you guys, honestly, just how do we value one another? How do we show up differently? How do we do better? How can we do better? And I'm always going to go back to just be curious. Don't be judgmental. Be curious. Always ask better questions. Don't be afraid to ask questions, because we all have we all have amazing ideas that a lot of times we're just hanging on to because we're like, yeah, they won't like it, or it won't change anything anyway. But you never know till you have those conversations, and somebody might be like, oh my God, that's amazing. Why didn't you talk about that sooner? And then you're like, oh God, I don't know. I didn't feel like anybody would care. So yeah, so it should be a good conversation. And I appreciate everybody that was here today. And I know we are looking at an hour and a half, and Andrew needs to go to bed. So my closing takeaway from today was this was wonderful. And I know that we could talk for hours about this. And but I feel that, like Kenneth said, we scratched the surface today. I think that we had a good conversation. I think that we brought some ideas up to have other people think differently, to have people look at things differently, and taking into consideration everything that we uncovered today. Just the simple things, just that simple showing up, that simple act of presence and acting intentionally, and not just everybody just nodding their head and nothing changes. So, Andrew, from me and my heart, thank you for being here today. After your rough night, we love you. Love you, love you.
Well, thank you so much for this opportunity. Yes, I do have to go back on shift tonight in the ER, and then leave there, do a little commute, and come back to work here in the mornings. So,
dude, you gotta give yourself some grace.
Yeah.
Will you take a freaking break, for God's sakes?
I'm a farm kid. We only know work. It's, I got my boots on right now. So
I know you do. Yeah, those Ariats on. I know.
But show up, lead, be there for your people, take care of them. The people are the most important resource that we have. Healthcare is a human enterprise. It's about taking care of humans, both the people in the bed and the people caring for them. So work hard, get engaged.
Right.
You already answered the question that I was about to ask you, but so you may not know, we have always about 47 to 52% of audience who are leaders on LinkedIn. So my question for you already answered actually, but my question for you was, what do you want, or you will ask to these half audience or all the audience, because I believe that all nurses are leaders anyway. What do you ask them? What's one or two things that this audience should do for you this following week?
I'm sorry, say that again.
What do you want the leaders who are listening to you today can do for you in this upcoming week? What do you ask for them for this week that's coming?
Take some time, carve out some time to sit down with your team individually. Go see the people, listen to the people. You'll be surprised what you learn.
Amen.
Thank you very much.
Amen. Just be present.
Absolutely.
Thanks a lot. It was nice to see both of you.
Thank you very much.
Please get some sleep. Go take your boots off and go get some sleep.
Thank you, everyone.
See you again soon, I'm sure. We'd love to have you back. Absolutely love to have you back.
Thank you. This was great.
Thank you. Thank you very much. Thank you, everyone who come in today and enjoying this live and interact with us today. We appreciate you so much. Thank you for coming. Please continue to comment. The conversation is still going on. Share with others you think this conversation can be benefit, and we love you all. Thank you. Like, share, subscribe. Thank you.
Bye, everybody. Bye. Thank you. Happy Sunday. Happy Sunday.
Go
do something. Andrew, go to bed.
Bye.
Bye.